Hey, good afternoon, everyone. My name is Ann Wong with the Illinois Chapter American Academy of Pediatrics, and I thank you for joining us for today's webinar on ICARE data quality for the Chicago Department of Public Health. Today we are joined by Elisa Jones and Tam Go from the Chicago Department of Public Health. Before we begin, I would just like to go over a few housekeeping items. This webinar is being recorded. Everyone will receive a copy of the PowerPoint slides, a link to complete the survey evaluation, and a link to the recording of the webinar by the end of business day. If you have any questions for our speakers during the presentation, please enter them into the question box on your control panel for the webinar located on the right-hand side of your screen. Your questions will be answered at the end of the presentation. I would now like to introduce Tam and Elisa. So first we have Tam, who is a CDC Public Health Associate who's been assigned to CDPH's immunization program. She works closely with the VFC program and is also coordinating flu clinics with the 50 alderman offices in Chicago for the current flu season. She holds a BA in sociology and 2 minors in history and health science. Tam came to Chicago from San Jose, California, and has loved her time so far in Chicago. Elisa Jones is a seasoned public health and social service professional with extensive experience in areas of training, public speaking, data evaluation, and quality improvement. For the past 16 years, she has been a public health administrator at the Chicago Department of Public Health's immunization program. Prior to coming to the immunization program, she spent several years in HIV prevention education as well as in the case management field. She has a MS in Human Services Administration from Spertus College and a BS in General Studies from Shimer College. Please join me in welcoming Elisa and Tam. So I'm now going to switch it over to your presentation, Tam. So, all right, whenever you are ready.
Thank you, Anne. Thanks everyone for joining us today with this ICARE webinar on data quality. Disclosures, Lisa and I have no relevant financial relationships with any of the manufacturers or any of the products or providers and we're not going to discuss any unapproved use of commercial products in our presentation. ICARE is a statewide immunization registry that is owned and maintained by IDPH, and the VFC information presented only applies to the Chicago VFC program. So not anyone in the Illinois VFC program. Some objectives that we have today are going to be to explain the password resetting procedure, highlighting the PRA role, and reviewing factors that can cause vaccine inventory discrepancies and invalid doses, as well as to demonstrate helpful ICARE features and reports. Just wanted to start off with updating password, as we still do receive phone calls about how to update your password. So if you haven't done so already, please go ahead and go to imreg.illinois.gov to register for updating your password via online. And if you've already registered and you remember answering questions like what color is the sun or what color is the sky, because it'll ask those type of questions, and you remember answering those, go ahead and go to imreset.illinois.gov to be able to reset your password. And these links are on the homepage of IDPH web portal. Before you log into ICARE, you can see these sites. And then if you've forgotten your password, or if your password has already expired and you forgot to reset your password, you can go ahead and call the number for IDPH's help desk, which is 217-524-3648, and they'll go ahead and help you actually register for the imreg.illinois.gov and then reset your password from there. And then from then on, you'll have to go on imreset.illinois.gov to be able to reset your password. So moving on, the Portal Registration Authority is someone in your clinic who approves all the new employees' access to ICARE. So Keymasters have the ability to check who the PRA is, and in some clinics or organizations where it's a huge organization, you might not realize who your PRA is. So that's when Keymasters could go ahead and check in ICARE on the clinic page. It should be should have a note under admin info for the PRA, or it'll be under the PR information. So once an employee registers for ICARE and they go to the IDPH web portal page and fills out all the information, you'll have to print out the information, and it has a line for PRA to sign to get the access to ICARE. And we would recommend to, once you find out who the PRA is, have them, and they send it to IDPH, have them either CC you on the email or have them email you back to let you know that they've sent your application to IDPH web portal. Because as some of you may know, the access to gain ICARE can be lengthy, and it's best just to be on top of when things are sent so you can follow up with your PRA or IDPH if necessary. And then in the case if your clinic doesn't have a PRA, you'll have to apply for one, and it's recommended for whoever plans to is long-term in the clinic, as this will have to be changed every time the PRA leaves the clinic. But we could send this PRA agreement to out with the webinar as well. And this is just the form to designate a new PRA or to get a new PRA onto your clinic. So moving on to data quality. Data quality is extremely important to your clinic because it has the ability to raise your immunization coverage level. It'll make it easier for you to see which patients need shots or if any upcoming shots are due, and that'll be a plus because that'll increase your profits. Can reduce the number of unnecessary shots given, which is huge, as to keep profits. And then it can also be useful for schools when they need their school physicals or other clinics. If your patient moves to another clinic outside of the city or anything like that, that data will be in ICARE. Or if they go to summer camp and they need their shot record, it's all in ICARE. So data quality is extremely important, and to have your ICARE updated and up to date with all the shots given and your patient information, it can be an extremely helpful application for you and your clinic. So just going over, we're going to be talking about these 5 topics as well. So for data quality in ICARE, your CVX codes need to be accurate, and CVX codes, they're used by the EMR to identify which vaccines are given. So each vaccine has their own individual CVX code and manufacturer code. So with CVX codes being correct in ICARE, doses will subtract correctly. So if your EMR technician needs a list of the correct CVX codes, this ICARE uses the CDC CVX codes, and that link can take you to all the updated and correct CVX codes. So with incorrect CVX or NDC codes, the EMRs won't be able to send the correct vaccine to ICARE, and then it'll not be able to subtract doses, leading to kind of a mess up in your data quality. So be sure your EMR technician knows that link I referred to earlier, knows about it, and keeps the list correctly updated in the EMR. And then lastly, if you are using an EMR in your clinic, I would suggest checking on a weekly basis, at the very least, to see if your EMR is transmitting data. And to be able to do that, you would just go to your clinic tab in ICARE and then check if there's an imports tab. Go ahead and click on the imports tab and then check if that date that you see on the screen there is today's date. And if it's not today's date, it'll have the date that it was last transmitted. And if it was maybe a week ago or 2 weeks ago, then it stopped transmitting, and I would contact your EMR technician to figure out what's going on with that. And then if you have any, if your EMR technician or if you have any questions about the EMR, go ahead and email dph.hl7icare@illinois.gov for any questions related to EMRs. And I believe now Lisa's gonna take us through some other important aspects of data quality.
Yes, thank you, Tam. I'm Elisa Jones, and in my position, I am involved extensively with ICARE. As part of the assessment process, we use data that is in ICARE. We don't have access to a clinic's EMR data, and so that's why we now download all of the immunization data from ICARE. So if all the data is not in ICARE, it appears that a patient is not up to date, or if the wrong dates are in ICARE, it can appear that a patient received a dose too early. It can also, shorten the interval to the next dose, and that sometimes the vaccine record may have been estimated by someone where the actual dates were not in ICARE. And so all of these can cause invalid doses. And sometimes a dose was actually given too early. So there can be a number of things that cause a dose to be flagged as invalid. ICARE strictly applies ACIP guidelines, and it will flag a dose if the vaccine was actually given too early, such as DTaP4 or Hep A number 2. They should be 6 months from the previous dose. ICARE does accept the 4-day grace period, right? But if it's earlier than that, then the dose is not considered a valid dose. Rules can be complex. Hep B has a number of rules that apply to between dose 1 and 2, between dose 2 and 3, between dose 1 and 3, and of course the patient's age. If they're an infant, they have to be at least 24 weeks of age. So all of those rules apply, and if any of the guidelines are not met, then it will not be considered a valid dose. HPV vaccine, as you know, the guidelines have been updated to incorporate the 2-dose schedule for patients who receive the first dose between 9 and 14 years of age. They only need 1 more dose, and that has to be at least 5 months from the first dose. That's the minimum. The recommended interval is, of course, 6 months. So ICARE has been updated to incorporate the latest guidelines. If vaccines are given too late, if the first rotavirus is given past 14 weeks, 6 days, then it gets flagged as invalid. If dose 3 of rotavirus is given past 8 months, 0 days, then that also will be flagged as invalid. If the wrong vaccine is given for the patient's age or dose number, such as Kinrix or Quadricel, being given before 4 years of age or after 6 years of age. If Proquad is given past 12 years of age, then again, it flags those doses because the vaccine is not recommended for that age or that dose. Summary recommendations handout is very helpful. It describes in detail the recommended and minimum intervals. And there are a number of other handouts that can also be helpful. Live vaccines, MMR and varicella, and in the past, the Flumis nasal spray all have to, or had to in the case of Flumis, be given on the same day. If it's not the same day, there has to be a 28-day interval between live vaccines. Otherwise, whatever was given second is considered invalid. Sometimes I've seen typos where someone put in maybe the 28th for one day and then accidentally put the 29th for the varicella, maybe 28th for MMR and 29th for varicella. And that just that one little typo, the 29th, if they're both given the same day, now that makes varicella invalid in that case. So typos can definitely be part of the reason why doses appear to be invalid. So any doses that were given too early or appear to be given too early will not count as up to date. And ICARE will forecast for another dose to be given, and that dose must be given at the correct interval from the invalid dose. In other words, if it wasn't a 28-day interval between MMR and varicella, if varicella was given second, then now it forecasts 28 days from the invalid dose. Keep providers and all staff informed of the latest guidelines. You can register at immunize.org to receive the latest updates. Now they have a weekly publication that they will email that describes any new guidelines or updates regarding the immunizations. There is an invalid doses report on ICARE that can be run. As we said, invalid doses can simply be data entry errors. Many different people, often at various clinics, enter data into ICARE. Sometimes you'll see mistakes highlighted in pink. Typos, such as 5.1 instead of 5.11. If 5.1 is too early to be a valid dose, then it will flag. For instance, if you need a 6-month interval from the previous dose. If the same dose is entered twice, if maybe the MA thought that they were going to give IPV and then they decide to give Pediatrix, but they put IPV in the EMR, if that transmits to ICARE, then you'll have IPV and Pediatrix on the same day, and then that'll flag whatever came through second as invalid. Deleting from the EMR generally does not remove the dose from ICARE. I've heard that occasionally some EMRs might do that, but my understanding is that you have to log into ICARE and actually click on the little box next to the invalid dose and then delete that dose. It is your responsibility to fix the invalid dose by either correcting the date or giving another dose at the right interval. So invalid doses also can stem from other employees, such as at WIC offices, that perhaps might enter estimated dates into Cornerstone. Cornerstone is the WIC's EMR, and that when they enter in the shot record at the WIC office, those doses then flow directly to ICARE. For instance, a patient perhaps is born on 1/13/16, and then the clerk might enter 3/13/16, 5/13/16, and 7/13/16. Maybe perhaps they were in a hurry and they didn't feel they had time to enter the correct dates, or for whatever reason, they enter sometimes the incorrect dates. And then when those dates show up on ICARE, they conflict with the actual dates that have the lot number next to them, and then it makes the valid doses invalid. If you see CETA WIC or a non-medical agency, such as HRDI, Henry Booth House, other social service programs listed, then that indicates that that was not a medical clinic and that it was actually a WIC or office. If there are doses with lot numbers given close to those dates, you can delete the dates without lot numbers. Okay, you don't have to worry about that. You can delete any date that you can tell is not an actual valid dose or actual dose given. All of these invalid doses or typos show up on the invalid doses report. As I said, if there are no lot numbers listed, you can delete or edit the dates. If there is a lot number, you should contact the clinic that gave it and request them to make the edit. Here's the invalid doses report that you can run from ICARE, and it highlights and explains we deleted the patient's name, but it lists the shot date, the vaccine group, and the reason why it was invalid. Either it was given to past the maximum starting age, or the minimum interval was not met, or whatever reason. Merges. If there are two records for one patient, the merge feature can be used to request a merge. Sometimes a patient may have been entered twice, sometimes with a middle name, and then other record does not have the middle name, or there's a different address. So you can request a merge, but you have to make all of the demographic information the same. So it has to be the same address, same name, same, everything must be identical. Infrequently, two patients' records were accidentally merged into one. A patient might have 8 DTaP dates given at 2 different clinics in different cities, and this patient will even have 2 different Medicaid numbers listed. And you can use the Contact Us button and choose ICARE to request the merge, or in some cases, in that case, you would request for the patients to be separated, and they'll investigate and separate those patients if they have accidentally been merged into one. There are many helpful reports and tools in ICARE. There's a coverage report, refresh list feature. You can document immunity. You can avoid duplicate records. And we have the analysis helper and the inventory reconciliation. ICARE can be used to run reports that show what percentage of patients are up to date for their shots. It's recommended by the CDC that clinic staff review their coverage levels on a regular basis. This info should be shared in your clinic meetings. Setting and meeting improvement goals is very rewarding. You can run a report for adolescent patients who are 13 to 17 years of age. It will look at Tdap, polio, MMR, Hep B, varicella, meningococcal being up to date, meningococcal 1, meningococcal 2, HPV 1, HPV up to date, and Hep A 2 or more doses. And then at the bottom, it will even evaluate the flu shot coverage level. For childhood, that's patients 24 to 35 months of age. And then it looks at all of the pediatric doses that are due by 2 years of age. The refresh list feature is recommended to be used regularly. Refreshing your patient's list will remove patients that have not had a shot or had the record transcribed in 1, 3, 5, or 10 years. Now, most clinics use 3 years. So as you know, when you give a patient a shot, it puts that patient on your ICARE list as an active patient. And that patient stays on your list unless you remove them manually or by using the refresh list. The refresh list will quickly remove patients who have not had a shot at your clinic in that designated amount of time or had their record transcribed. This will help you focus on assessing and recalling your most active patients. And when you use the refresh list, it does not remove the patient from ICARE entirely. It just disconnects that patient from your clinic. So when you run a coverage report or a list of patients who need to be recalled, who are missing doses, it will only include the patients that are your active patients. If a patient has had chickenpox disease, this can be documented on ICARE. This will make them up to date, raising your rate, and keep ICARE from continuing to forecast varicella vaccine. It'll say vaccine overdue. So it's important that that's documented on ICARE, right? And this shows how that can be done. Now, all the information that I'm going over is available on ICARE, and you can consult your user manual on ICARE to refresh your memory. So you have to put in varicella and what date the patient had the rash, what date it was reported to you, and then it will take away the reminder to give varicella. And it will show up also on the school physical form as well as on the patient's immunization report. Updating ICARE records. Patients may have had vaccines that are not listed in ICARE. Suppose your EMR was connected, and we call that interfaced, to ICARE on 4/1/13. Generally speaking, only the doses that were entered into your EMR on or after that date will be automatically transmitted to ICARE. It's recommended to transcribe all historical doses listed in your EMR to ICARE. This will ensure that the entire shot record is in one easily accessible location. As I said, when we conduct our immunization coverage assessment visits, we use the data in ICARE, and that if the dose is not in ICARE, then it appears that the patient is not up to date. Even though if the patient is attending the public schools, then they had to have certain shots, Tdap, meningococcal, and so on. But that, again, we can only, and ICARE can only count the doses for which there's an actual date listed. When entering doses given in the past into ICARE, it's not essential that the historical button is checked. Doses are only deducted from your current inventory if the lot number is currently listed in your inventory. Okay. So you can, you don't have to click on that historical button. It's important to search for a patient's record first to avoid adding a duplicate record. Be aware that names can be spelled differently than expected. For instance, Ebony could be E-B-O-N-E-E instead of E-B-O-N-Y, or it could be a hyphenated name. You can even search by Medicaid ID, or you can enter fewer letters. You can enter as little as 3, letters of the first name, or 2 of the last name. You can also add the date of birth or delete the date of birth. Sometimes I've had to search in a number of different ways, and it did pull up that patient eventually. Inventory. Okay, now Tim is going to resume and cover the inventory analysis helper report.
Thanks, Lisa. So the inventory analysis helper report identifies reasons specific to your VFC inventory levels. It can be a great tool to see exactly why doses weren't being subtracted in your inventory. This is an example of what it looks like. When you run the report, it'll have the patient information as well as the shot date and the vaccine that was used on the patient. And these doses did not subtract from your inventory. So the inventory analysis helper report actually does a great job showing all the information and explaining why the doses did not report. If you look in the middle, it's bad vaccine code. It states that these shots are appearing in this report because they are historical and they didn't deduct from inventory, but there is a VFC lot number that matches what was used. So for some reason, it didn't deduct, and you can see the origin being HL7 import. So in this case, we would want to work with the EMR technician to ensure the correct CVX code, as I was discussing earlier, to ensure that it's matching the correct codes. So in your EMR to ICARE, so we can deduct from ICARE. Another reason would be bad lot number. You could see that it explains that these shots are appearing in the report because they were sent with the VFC code and the patient was eligible, but no matching lot was found in the inventory. Again, this would be working with your EMR technician to fix not have this issue occur. And then when running this report, it's recommended to go back and kind of fix the patients that's listed in your clinic, so you can get the correct dose accountability in your VFC inventory. Inventory reconciliation is not a report, but it's a helpful tool to correct overall inventory. This is, again, only available to Chicago VFC providers and not Illinois VFC providers, but it's a tool that's not going to be available in the near future. And with that being said, I believe maybe a third of the Chicago VFC providers no longer have this tool because we are moving everyone slowly but surely into phase 2, which is no longer having the ability to have inventory reconciliation. So for those of you in phase 1, you are still able to reconcile your inventory manually in ICARE, but please note that will no longer be available as you move into phase 2. So how you would reconcile your inventory with this inventory reconciliation tool, you would walk over to your fridge and freezer, take a pen and paper to write down the vaccines that you currently have in stock in your fridge and freezer, write down the balance of how much, let's say you have 10 HPVs in your fridge, you would write 10, and then you would go into ICARE and kind of go through that list and double check, do you have 44 DTAPs? If not, how much do you really have in the fridge, and kind of manually change that in ICARE. So then after you save that and you reconcile everything in your VFC inventory on ICARE should be exactly what you have in stock in your fridge and freezers. And moving forward, to maintain the data quality would be, like Elisa said, about the invalid doses, making sure doses are entering correctly to deduct from inventory, or just occasionally running your inventory analysis helper to see if any doses are not being deducted in your VFC inventory. So with that, we'll leave room for questions. Let us check, see if we're gonna have any questions. Feel free to type in your box if you have any questions.
Okay, so thank you, Elisa and Tam, for that. So I'm going to give everyone a couple moments real quick just to write down their questions. Just a reminder, that's going to be on the right-hand side screen on your control panel. And then for now, I'm just going to quickly go over everything else, just the general housekeeping for the other things. So we have a couple upcoming webinars. Our first one that's coming up is going to be on April 4th on a Wednesday, and that's going to be on updates to the 2018 0 to 18 ACIP immunization schedule. We have Dr. Candace Robinson from the Centers for Disease Control presenting. And then our next webinar will be on Thursday, April 26th on National Infant Immunization Week. And for the third year in a row, we have Dr. Mark Sawyer returning to present from us from the UCSD School of Medicine and Brady's Children's Hospital in San Diego. And then lastly, we have our annual business side of vaccines happening on Thursday, July 19th, with Becky Dolan from the AAP presenting. We also have a couple more that are in the works, so we'll keep everyone posted on that, and then feel free to register at that link below, and everyone will receive that 1 credit hour of continuing education credit. And then, so basically what happens next, everyone will receive a copy of the PowerPoint slides, a link to complete the survey, and a link to the recording of the webinar by end of business day tomorrow. You must complete the evaluation by March 28th, 2018. After this date, the evaluation will be closed, and you will no longer be allowed to fill out the evaluation or receive a certificate of attendance and/or continuing education credit. Lastly, you will receive your certificate by April 12th, 2018, and all of this will be done through email. So let's go ahead and see. So it looks like we do have a couple questions in. So the first one is, are you going to have another webinar like this one? At the time, I don't think that we do have any plans, but if there seems to be a general, consensus of interest, and we get people telling us that they do want another CDPH-focused ICARE webinar, then we can go ahead and potentially get one scheduled. And then the second question is, I have a few staff members that have expired ICARE logins and have not been able to gain access again. They have tried getting it via phone and via internet. What or where can they go?
Okay, great question. So that, as I said earlier, you can go on the IDPH web portal, and that will give you, that'll give you where you can go. It'll have the phone number, or let me click back to my slides. So if they haven't done the imreg.illinois.gov to reset their password, I would go ahead and call the 217-524-3648 number. Unfortunately, that the password login is all done through IDPH, so we at CDPH have no access to be able to change anyone's passwords or anything like that. So it would be that 217-524-3648 number to be able to go ahead and reset your password, and they should be able to help you out there. Oh, and once you dial that number, is option 1, and then click option 1 again.
Okay, so not seeing any additional questions. And then, of course, we also always offer the option that if anybody thinks of something that they can't recall right now, feel free to email any one of us, and we'll relay it over to Lisa and Tam, and they'll be able to do their best to get it answered. Otherwise, if Lisa and Tam, do you guys have anything else to add?
No,
not at this time.
Okay, great. So thank you so much to the two of you for that presentation. It was incredibly informative, and I think otherwise we are all set to go. And thanks again to everyone for joining our webinar, and we look forward to seeing you for our future webinars. Have a great day, everyone.